Hi, my name is Noyes. I'm a general surgeon here at Pardee Hospital. I went to medical school at Tulane University in New Orleans, Louisiana. I did my residency both at Tulane in New Orleans as well as the Navy Medical Center in San Diego. I'm board certified in general surgery and a fellow in the American College of Surgeons. Generally speaking, the thing I offer my patients is I actually spend the time to talk to them about their problems, to explain their options so that they have a full understanding. They don't ever feel pressured into what we're doing. Surgery and the decision for surgery is a pretty major thing, and I think it's unfortunate that medicine, the pressures allow people to not spend the time with their patients that they probably should. I originally enlisted in the Marine Corps back in 1980, went to boot camp at Parris Island. My nickname was College, which was not a good thing as an enlisted Marine, and ultimately ended up taking a Navy scholarship for medical school and then owed them time to pay back that obligation, and for a whole bunch of different reasons ended up staying active duty. I actually put in 20 years in the Medical Corps of the United States Navy. I was stationed all over the world, ships, submarines. I had a very good career. I was in Pensacola for about 12 years and did 2 tours in Iraq, one right after the ground war started in the desert in the south, and once my second tour I was in Fallujah for the battle in November of 2004, which was a pretty large engagement. And then my last tour I was in Afghanistan in downtown Kabul helping train the Afghan military, and I figure if I didn't retire in 20 years they'd probably send me back to Afghanistan again, so I put in my papers and retired about 2.5 years ago and came up to Hendersonville. I've always had a little bit of North Carolina in me. I was an undergraduate at Duke University, and so I did my engineering degree undergraduate at Duke University, and then moved away from North Carolina many years ago and was all over the country with the Navy. And when I was looking to retire from the Navy and go into private practice, there were just no good openings in Pensacola, Florida, where I was, and I started looking, and I'd always had an interest in coming back to North Carolina. As a general surgeon, I run the gamut of most of the things that a general surgeon does. I do a lot of breast work, I do a lot of thyroid work, we do colon, gallbladder, appendix, hernia. We routinely do upper and lower endoscopy as well. Probably the most common operations that I do are hernia repair, gallbladder removal, appendix removal for appendicitis, colon surgery, especially for colon cancer. I do a lot of laparoscopic or minimally invasive surgery and a lot of upper and lower endoscopy, including screening colonoscopy for colon cancer prevention and detection. And the thing I pride myself on is old school bedside manner and actually spending time with my patients so they feel that they have had all their questions answered and been educated into their problems so they can make an educated decision about what's in their best interest for care.